Folks, thanks for coming on the line with us today. This is John Dubas with another Premier Marketing Moment, and we're going to spend the next few minutes discussing how you can use one of the tools that are available to you as a contracted agent with Premier Marketing, available to you without cost, how you can use that tool to cross-sell health plans electronically, efficiently, effectively, and compliantly. The first thing you need to do, however, is get access to the system, and you can do so by going to our website at premiersmi.com and requesting that access. And we have a number of different tools that we make available to you. The one that's on the screen now speaks to MedicareCenter, which is an enrollment tool that acts as a CRM as well for Medicare Advantage and prescription drug programs. It also allows you to collect an electronic scope electronically and store it for the required 10-year period, which you're supposed to do if you sell the appointment or not, in that system. It's a great way for you to also maintain your business year over year. But besides that, that's not the system we're here to speak of today. And what we're looking to do is give you some information on a component of a system that's part of a quoting tool made available that can give you information on Medicare supplements, Medicare Advantage plan data, hospital indemnity programs, final expense plans, and dental programs. Yes, it's the one that's referenced in this particular slider on our website at present. It's one that you may be familiar with if you have done a number or are familiar with the CSG tool that we make available to our agents without cost, that helps you not only determine what might be the most competitive Medicare supplements in your market for you in order to help you contract properly with carriers in your chosen space, but it also gives you the opportunity to go through and do a number of other things that we're going to illustrate really quickly here today. One particular component, which is a cross-selling feature. Once you have access to the system and you sign in, it's relatively simple to utilize this program to make certain that if you go into a home or if you're doing some things remotely, you have the opportunity to make certain that you have a sale out of that house. And in many circumstances, if you're in a particular market where it's dominated by one Medicare Advantage plan, particularly, or if you go into the house and that individual is very happy with that program, is using you to shop and get additional information on other programs, but sticks with the plan they have, it still gives you an opportunity to sell something else, not only just to sell it, but to serve a need for that individual and to cover a hole in the coverage that they have with whatever carrier it happens to be. So if we look at the menu when we're in the dashboard, it tells us that we have an opportunity to run final expense life quotes, hospital indemnity programs, dental programs, and we can store and collect the scope of appointment with this tool as well, which is very helpful. It also gives us the opportunity to quote and sell Medicare supplements with an e-app function and get additional information on Medicare Advantage and PDP programs. To begin with, one of the things we want to make certain we do is we remain compliant. So not only does having that electronic scope of appointment signed keep us in the proper space when it comes to compliance, it also sets up expectations about talking about other programs because it lists health programs on that scope of appointment. So when you look at this menu of products, well, you can discuss Medicare Advantage, Medicare Supplement, dental programs, and hospital indemnity programs in that appointment. It gives you the opportunity to do so because it is a menu of Medicare health products. In that appointment, if you are offering Medicare Advantage or PDP programs or Medicare supplement programs, a little bit different if you're just doing med subs, but if you're speaking of the Medicare Advantage and PDP space, You can't discuss that final expense product until you satisfy that 48-hour cooling off period. The point of today's presentation, however, is to look at how we can make certain that we can fully cover an individual in the Medicare Advantage space if we sell a Medicare Advantage product or not. If we do, it's an add-on sale. If we're not able to sell the base product, we can still take care of some of the holes they may have in their coverage based on this particular program. So let's just run an example of a zip code in the North Texas area. Doesn't matter. Whatever program is appropriate for your space, it's going to give you the options that you have in that particular market. Get the information that's available to you. It'll think for a moment. It'll pull the data eventually. And it gives us then a listing of the programs basically based alphabetically or however we set it up for it to do a sort, and starts with the zero premium programs rotating into the plans that have a higher max out of pocket and then perhaps even premiums in that particular space. You can see in Denton County, there's a lot of choices for a Medicare beneficiary in the Medicare Advantage space. In North Texas, however, one company does have a very large share of the market in the Medicare space, and that's United Healthcare. They've been here since, trying to think here, early in the 90s, even when Bill Lurie did some things with the funding of the Medicare Plus Choice plans, they still stayed in the 4 core counties of the Metroplex of Dallas-Fort Worth and have been here ever since. Strong network, strong plans. They have a good portion of the market share. So let's say that we're dealing with a beneficiary that has either purchased a United Healthcare plan from you or has a United Healthcare plan and is quite happy with it and is going to stay with it. We'll select that program. You'll notice by clicking on it, it turns it green and pops it up here into the compare quotes area. Telling piece, because then we look and we click on compare quotes, it pulls then the data for that plan into our space. Goes through a fairly thorough listing of the benefits that are there, but it gives us then the opportunity to fill the gaps. So what we're looking at here is an opportunity to show that same individual, and keep in mind, in this particular circumstance, we have to have their age and their sex, because unlike Medicare Advantage programs, these are priced based on age and many times in gender and whether or not they use tobacco. So let's just say this individual is a 67-year-old female. They have a set, but they're happy with where they are. This will then give us an opportunity to pull up the programs that are available through Premier Marketing for that individual in that particular market. And it'll lay them out for you, all those different carriers that are available there in the system. One of the things that we see in many circumstances is a very strong product in the hospital indemnity world with the medical program. So let's take a peek at that, pop on that program, add it to the comparison, and you'll see then that it'll give us the base program for that hospital indemnity program, what it costs for that Medicare Advantage plan. It's a zero premium program in this particular market, and based on a minimum of coverage for that individual for the daily benefit. What we're going to look to do, however, is transform that benefit to one that is close to the actual out-of-pocket for the hospital coverage for the MA program, and add to it, and it's going to tell us then, boy, we then have $300 a day for 31 days in this circumstance for that individual. It gives us then a way of quoting and filling the holes that a person has with the Medicare Advantage plan. When you look at these programs, and a advantage of a Medicare Advantage program over just having original Medicare is the fact that it does give us a maximum out of pocket, and it does give us then a opportunity to look at the different coverages and make certain that if there are any shortfalls that are found, we take care of them. It also tells us that here in network, that hospital stay is $325 for days 1 through 6. Let's check and see if we can't make that as close as possible. And we can. And we'll see there that it covers them very completely. It also gives us the opportunity to add in additional coverage should we choose to do so there. With that coverage, we're happy with it in a daily benefit as opposed to a lump sum benefit. And it then gives us then the other categories that may be a shortfall for that program. The skilled nursing facility stay, well, it covers it completely for the first 20 days, and then $160 a day for the next 22 days, and covered completely thereafter for that. Let's say they're comfortable absorbing that cost, even though we could have selected a benefit that could help them in that circumstance. Taking a quick peek at it, we'll see that that $150 a day for those 31 days is another $18. So let's back that off just in this circumstance and go down the rest of it side by side to see what else is necessary. And we can see then that it takes and fills that hole, which may be one of the big challenges for that individual for that Medicare Advantage plan. They love the program, they're happy with the network, but they have that shortfall should they choose to go, well, should they need to go into the hospital. And it's easier for them to budget about $28 a month rather than dealing with that $325 for 6 days that could be their financial responsibility if they are admitted in the hospital for that period of time. It also then gives you the opportunity to speak to whatever else you view as a shortfall with that coverage that comes as part of a Medicare Advantage program. And one of the things that does bring about is challenges with therapeutic radiology treatment, that 20% should they go through chemo and radiation treatment. That gives you the opportunity to speak to a cancer program or a cancer, heart attack, stroke program outside of this software package and address that need as well. One of the other things that we see for these folks is the opportunity to use this quote engine also to add in dental coverage. While the United Healthcare package in this particular market does offer some dental, many times a individual doesn't have enough dental with a Medicare Advantage benefit, and you can add to it in that circumstance as well. You can then take this piece and save it to a PDF, and if you're visiting with the individual, it helps you walk through this exact presentation. It also gives you the opportunity to prepare ahead of time so you have the information should you get into the household and you don't have the internet coverage and you need that data ahead of time. So you've got an opportunity here to use a tool available to you without cost to just plug that extra hole, which may be a challenge for your now client that you're helping them take care of with an easy way to budget for, in many cases, an inevitable expense. This gives us then the opportunity to speak to the entire package of benefits, your portfolio of programs with a multitude of different companies, should you choose to do so. So that's your Premier Marketing Medicare tip of the day, and I thank you for the time that you spent with us. Take the opportunity to play with this software program and make it part of not only your consciousness, but use it in the household with the folks that you visit. Thanks for coming on the line, and we look forward to visiting with you down the road. Give us a call if you have any questions. And in the meantime, we wish you good selling. Thanks so much.